I was a deaf person in Papua New Guinea, but then when I got the Australian Development Scholarship, I came over to do my studies. And as I came through, there was this opportunity for me to also address the disability that I have. So, when I came through, I had my ears tested, and I found the right medical assistant, and that was for me to have an operation, get my ears back. And when that happened, it got my whole life back.
Joel Silas is a senior university tutor in Papua New Guinea who undertook a Masters of Information Technology at the University of Southern Queensland. Joel's placement was with Queensland host organisation Hear and Say, one of the leading paediatric auditory, verbal and cochlear implant centres in the world.
I thought it was the most wonderful opportunity to be involved with the Prime Minister's Pacific Australia Awards, and Joel was the most delightful character, and he has a very personal story which fitted in so perfectly with everything we do that it's been a happily ever after story from beginning to end.
Dr. Timothy Dornan is 2010 Queenslander of the Year and founder of Hear and Say.
Hear and Say is a centre for children with hearing loss. We have services for over 500 children ranging in age from birth to 28 years of age, but by far the greatest number of children are in their early years, so between 0 and 3. We teach both parents and children simultaneously, so our core business is really adult education. The children use the latest in hearing technology, so either they receive a hearing aid from Australian Hearing or a cochlear implant from us or from one of the hospitals, and then they go ahead to learn to listen and speak, and they catch up to their hearing peers very quickly.
They're really helping the deaf children to be up on equal footing with the rest of the other normal kids, and that's the thing that brought us together.
In every possible way, he's contributed to the organisation, and we've just loved having him. He became a real team member while he was here.
Joel embraced the opportunity to engage with staff at Hear and Say and spent a lot of time in discussion and planning with Megan Hasty, Hear and Say's e-learning coordinator.
At Hear and Say, we're using e-learning to help decimate the effects of hearing loss all around the world. So this enables people like Joel to access valuable resources that will help him improve his own education and access health services. So at Hear and Say, we're using what we call a blended cyber mode of delivery, where we have our course content recorded on the platform, and it is a virtual classroom. And this is what we've used with Joel.
Some of the things that I really kind of picked up was with the e-learning, where Megan taught me how to write some of the models for the teachers to use, and even for the students, participants.
The research that we've been undertaking is showing that these types of e-learning environments are actually outperforming most others, including physical face-to-face. So we're wildly excited about this type of technology and the impact it can have in education, and particularly in developing nations like Papua New Guinea.
If we really want to get something done in Papua, a similar setup, definitely most of the things that I've learned here would be very, very useful.
Joel arrived at Hear and Say with a passion for helping deaf people in his home country. It was a passion that was recognised by Dr. Dornan, who also dreams of opening a Hear and Say centre in Papua New Guinea. Joel was a vital link in helping to make this happen.
When I met with them on the first day, and they asked me what are some of the things that intend to do. And I told them again that my vision was to have an e-learning center at home, at my village, and that my village would become a model education and health for Papua New Guinea.
There are as many deaf children in Papua New Guinea as there are in all of Australia. And we really, as their closest country and their closest cochlear implant program, we needed to make a much bigger start. So Joel has made connections for us in Kerawagi, which is his hometown, and the nearby hospital. So we're going to do birthing education for doctors and nurses to reduce the numbers of children who have difficult births and therefore have a potential disability. The way we're going to do that is with newborn hearing screening, with fitting the latest hearing technology, and then teaching the parents and the children and all the people in their community how to teach that child to learn to listen and speak. So Joel is giving us the opportunity to share our knowledge so that we can teach other professionals how to do it.
Right now in Papua New Guinea, we do not have an organization that is really, specifically focused on deaf children. What I'm trying to do is to use them, get them over, and then they could be a new organization in Papua New Guinea that is more, focusing on just deaf children.
The most important thing to realise about hearing loss is that not only is it the most common disability in newborns, but these days we have the power and the knowledge to virtually eradicate deafness right across the world. So if you look at the transformation that we're able to do today, it's awesome. It's the first time in history we've had this great confluence of developments which will allow us to make this huge change for a child and a family's life. So if we know, why shouldn't we share?
The ENSA have changed my life. They've brought in the confidence. They've made me feel more great now. And for me, I'm grateful to meeting some of the wonderful people in the world, the Australians. I'm now able to talk, feel free to, socialize with other people, and as I've said, an experience that I will never forget.
Joel achieved the objectives of his placement, but more than that, his time at Hear and Say allowed him to build confidence and knowledge far beyond his own expectations.